When you talk about size, it's really hard to beat the North Shore Long Island Jewish health system. It's a very, very large system, and I'm here now with John Bosco, who is Chief Investment Officer at North Shore Long Island. Welcome.
Thank you.
Well, you're doing a lot of things at your hospital system that can be viewed by your colleagues elsewhere in the country as to how to do things right, and you've probably made some mistakes along the way, but tell us some of the successes.
Well, our biggest initiative is to try to create a connected community of providers, the physicians and the hospitals that are part of our health system, our laboratories, our pharmacies, our post-acute facilities, like we have a home care network that has almost 1 million patients that they're taking care of. So we are trying to connect all of them together using the electronic health record as the enabling technology, and we really truly believe that in the future the way to improve quality, the way to reduce cost, to increase efficiency and safety for the patients requires infrastructure like the electronic health record.
And about a year ago you took a pretty bold move and asked about 1,000 physicians to get wired in their offices?
We actually put an offer out to 8,000 physicians,
8,000, right.
And said that we would subsidize up to the extent that the law allows us to, that we would subsidize putting an electronic health record in their office. So we made an offer to all 8,000 physicians that we would give them almost $40,000 apiece if they would install electronic health records and if they would connect them to other providers and our hospitals.
And did they welcome this?
They did, but it's slow going. There's a lot of culture change that's involved in physicians installing an electronic health record system in their office. It's very disruptive. It's very challenging for them.
Time-consuming.
It's time-consuming. It's financially challenging for them to do. Most of them have been practicing medicine their whole lives without an electronic health record.
We talk a lot about a nationwide information sharing network, but actually you're trying to do it just within your own community. And is it challenging?
It really is. It's going to take time. It involves just a tremendous commitment by the executives and the leadership of our health system to doing this and to seeing it through. It's not something that's going to happen over the course of even a year or two. It involves a lot of education and awareness and collaboration with the physicians to do it. And it involves really staying by their side. When you install an electronic health record system, it's really only the beginning. It's the adoption that occurs afterward. And so we're out there in hundreds of physician offices putting in electronic health records, but then we have to collaborate and communicate with them afterward to make sure that they're really using it the right way. As a matter of fact, we like to use an analogy that installing an electronic health record system is like a marriage. There's a lot of planning and a lot of excitement and a lot of work that goes into that one big day when you turn on the electronic health record system. But it's really what happens after that counts. It's really how the physician comes to use it and how they come to grow with it and how they come to love using their EMR. And so it's not just about getting them electronic, it's about everything that occurs afterward. How can they best use it to benefit the patient?
Well, it certainly sounds like you're using as much technology as you can to really get offices up to speed, but are the technologies really keeping up with the healthcare needs that we have going forward?
I think they are. I think they still have a long way to go. I think the electronic health records that exist today could be more intuitive for physicians. They could reflect a little bit better how physicians like to practice. They're very complicated. So I think that it's not really the technology that's the limiting factor today. It's really the culture change. It's really convincing providers that electronic health records is the way to go. And I think that's the big hurdle to get over right now. I think the technology will grow and mature as we go along.
Is there less duplication of services and healthcare delivery by using these electronic records, and do patients really know the difference, that they're getting that and not the old-fashioned way?
I'm not sure. Some patients do. I think a lot don't, but I think some recognize when they go from physician to physician the benefit. I happen to see my physicians are, it's a large multi-specialty practice, and they all use an electronic health record. And as I go from physician to physician, I like the fact that, if I go to see my primary care physician and then I go to see an allergist, I like the fact that that person, that doctor, has complete access to my medical history, and
Absolutely.
I don't have to give them all the information all over again.
Right.
I think another great example is when a patient presents in an emergency room. Typically, you don't know anything about that patient. They might not even be in a position where they can tell you anything about them. If we could pull basic information electronically out of a physician office EMR, what problems is this patient being treated for? What medications are they on? What are their allergies? Then we could eliminate duplicate testing that's taking place. If we know they had a CAT scan or they had an MRI yesterday, and we knew what they were being treated for and we knew what the results of those tests were, we could avoid maybe doing that test again when they come to the emergency room. Right. Otherwise, if we're starting with a clean slate, we have to do a full run of tests to really understand what's going on with the patient.
Wasting time and resources, really,
right.
for that.
And putting the patient through that drama and that trauma of having to take all of those tests.
Would you agree that patients also have to advocate for themselves more and be more involved in care?
They absolutely do. And the whole issue around personal responsibility in taking care of themselves is very important. If you prescribe medications for a patient to take and they don't take them, then all the technology and all the health care in the world isn't going to do any good.
Right, or be aware of really why they're taking this,
right.
And constantly being able to access information about that. That's important too?
No, absolutely, and I think electronic health records can help in that area too. We can send emails out to patients saying, as reminders, to say it's time for your annual mammogram. Or if we have a diabetic patient and they're supposed to get a podiatry exam and an ophthalmology exam once a year, we can send reminders out to them, and if we could get that information back from those providers to know that they actually did it and they made those visits, we could take much better care of the patient.
How long is it going to take, John, for your community of hospitals to be completely up and running all electronically?
Our hospitals, we're on different schedules in the different care settings. Our hospitals and emergency rooms, it's going to take, in the emergency rooms, about 3 years, and they will all be up on electronic health records. The hospitals, it's a 7-year project to get through all 15 hospitals. Wow. We have a 2,000 physician medical group that we own. That's part of our health system, and that's a 4-year effort. And then in terms of the offer that we put out to the 7,000 physicians, I think that's going to be quite a few years before we can convince the majority of them to do it.
Are people at the conference paying more attention to what you're doing, given that we've been through all of this reform talk and really trying to cut costs and build efficiency? Are they more interested now?
No, I think they are, and I think it's challenging and it's complex to do, and I think everybody is looking for whatever advice and whatever best practices, whatever they can learn from the bigger health systems that have gone through it. I think there's a lot of good information to be shared, and people want to know it. And
your most important piece of advice for other communities that might be embarking on this journey?
You have to be willing to listen as much as you are educating and trying to affect the culture change. You also have to be willing to listen to the providers. What do they need? How challenging is it for them to do it? You really have to understand what it puts them through to do this, and then work to make it as painless as you can.
All right. John Bosco, thank you very much for stopping by. I'm Abel John. You're watching continuing coverage of the 8th Annual World Healthcare Congress in Washington, D.C.